Hey everybody, Dr. Stavros here, aka Stavros USMLE, Friday, May 9th. Going live for a little bit. Why not? I can spend some time with you guys, right? That's the whole point. So welcome. To see who jumps on, I jump on when I can throughout the week. Right now, I have a few sessions coming up soon. So I figure let me just jump on for a few moments and see what's going on, see how you guys are doing. So please ask questions. Yeah, I'm always here for you guys. This is what I do, right? Besides working with me one-on-one or working with me one-on-many with our live sessions twice a week, I want to help you as best as I can. So I have some questions I want to answer. My team and I collect questions throughout the week. Many students reach out to us on Instagram, Facebook, TikTok, Instagram, LinkedIn, everywhere that we have, wherever we have social media, and also emails and text messages, right? So, and I love to be able to answer questions, because if I could answer these questions could be possibly yours. And instead of you wasting 1, 2, 3, 4, 5 months or money on certain resources, you can say, well, I saved time. I've saved some money. Time is the big factor. Money you can replace, but time is the big factor. And if I can save time, then guess what? It's actually pretty good, right? Yeah. My students are saving time, 100%. So if my students are saving time, you should save time as well. Why? Because time you cannot replace. This is my website, USMLEtrainings.com. Take a look at it. Whether you want to jump on with me one-on-one, have an hour consultation, or jump on all with our students, with all our students when we go over live session questions, USMLE. You can jump on, check out our website. Everything is there for you to register to start working with us. We actually finished week number 2 this week. We so far have covered immunology, microbiology, biochemistry, and cardio. Starting next week is week 3, when we go over respiratory and renal. So it's pretty good, because all our students are passing step 1, and all of us that have worked with me, all of us, because I feel like it's a win for me when I work with everybody, because even though I haven't taken the test, I've taken the test, if that makes any sense. So all the students I've worked with, I've had the pleasure of working with, have gone on to step 2 and scored 245 plus, which is awesome, because then they can get into any residency they want, because residency is challenging. And that's so for another time. I'll have more residency sessions that we do later, June, July, when the match starts in September, right? So love to answer some questions. Let's see. Dr. Aditya.xo. Is it possible to pass step 1 with 4 months if I start from scratch, considering I'm a 5th-year med student IMG? Yeah, I don't see why not. And I'll say this because I care, and because I have a lot of students I've worked with who are IMGs, who are from all over the world, who are in their 3rd year, 4th year, 5th year of medical school. And it all depends upon how much time you have. If you said starting from scratch, yeah, 4 months might be cutting it short. But think about it. You need to know immunology, microbiology, biochem, and you need to know all the organ systems. So if a student, I'll give you an example, student could be home studying 7 to 8 hours a day. Respectfully, if you're home studying 8 hours, you might not be studying all 8 hours, but ideally an 8-hour interval throughout the day. 3 months plus, 3-4 months the most, with a good study plan and good resources that work for you. That being said, you're in school, right, Doc? 5th year, which is awesome. So you're not trying to get back into the zone. So 4 months, I think, is very, very doable. You should definitely get my 3-month study plan. Just reach out to my team, USMLEtrainings.com. Subscribe. You can jump on board. And all my students that join us get the 3-month study plan. And again, everyone has different times when they use their study plan. It could be 2 months, 3 months, 4 months, 5 months. But ideally, it's the same sequence. It's just you have to know how to fine tune your studying, right? Plus the resources. So I hope when you jump on and watch me and join these sessions, you understand that some students use UWorld, First Aid, Pathoma. It works for them. It might not work for you. It might work for you. It depends. So you don't want to waste 3 months to use certain resources and say, I've already dedicated 3-4 months of my life, and I'm realizing I'm scoring 35-40%. So some advice for me to you: if you are studying, hit it hard each and every day, 6 days a week, and assess yourself. Like I assess my students. I always ask them, how are you doing? Why are you getting the questions wrong? I see Dr. D on board from Brazil. She knows I ask her all the time, like, listen, how are you doing? Right? Assessing yourself is key. It's important. If you don't assess yourself, you won't figure out what you're getting wrong. So the quick answer, yes, you're good to go on board, passing the test in 4 months if you have a good study plan. Right? Cool. All right, I got a couple of questions I want to answer that were sent to my team late yesterday into early this morning. And feel free to participate. Here's a smiley face. Ask questions. I got YouTube running. I got LinkedIn, Facebook, Instagram. I got everything right now. So ask questions as I answer these questions, okay? There was a question asked, how many NBMEs, and I hope you guys know what NBMEs are. NBMEs are exams provided by the USMLE organization that are pretty good, but you've heard what I've said. I don't like them because they're short scenarios and they test you on concepts. They test you on, do you understand the concept? And you have to be able to read between the lines. So NBMEs, most medical schools require students to take and do well to get sponsored and to be approved to take the step. So if you're a medical student and the school says, hey, listen, you got to pass an NBME, that's a whole different obstacle, because UWorld and Amboss, which are top 2 Q banks in the USMLE world, the question scenarios are really long. NBMEs are really short. That's why many students are passing NBMEs and failing USMLE, because they're so used to the shortness of the questions that when they're long, they can't keep up with the stamina, right? So the question is, how many NBMEs should I take before scheduling my step 1? If you have to take it, 2, I wouldn't take more than that. You could take more, but ideally, if you score above passing on 2 tests, that's pretty good, right? So combination of your QBank scores, right? Amboss, UWorld, preferably 60-65% higher. You have 2 NBMEs, cool. And you know, if you are using UWorld has an amazing assessment tests. You also have the 120, right? So ideally, the doctors that I work with, especially one-on-one coaching or the one-on-many that we have every Tuesday and Thursday, I give them a lot more, obviously, advice, a lot more hands-on, a lot more in-depth analysis, and obviously progress weekly. But for you guys here right now watching, NBMEs, I would only take no more than 2. If you score above average and you do well, and they say there's a 85+% chance on passing within 7 days, I wouldn't take more than 2. But schools require sometimes more, all right? Now, to piggyback off that question, so the question was, how many NBMEs to take before I schedule my test? I would say 1 or 2. Now, the famous question. Ready, guys? Listen up. Ready? Are you ready? I'm watching to see people ready. What NBME should I take first, second, third, fourth? I hate that question. That question gets under my skin. I'm like, guys, I don't care what you take. Take them all if you want. Take them in order, from lowest to highest number, highest to lowest number. I don't care. Majority of you ask, they go, hey, my friend, that's the famous line. My friend told me, my friends tell me, the community on Reddit tells me, yeah, man, so I got thousands in my community, and I can tell you it doesn't make a difference what you take. But what happens is many take one edition, let's say 31, and they say, well, I took this NBME 31 and it was so hard. All right, so it's supposed to be hard. I took the other one and it was so close to the exam, but they're all the same. They're all random. They're all hard questions. So a little advice, if you're watching here, please, guys, if you're watching this because you follow me, awesome. If you're watching this and you are in medicine and you're studying, take this advice. You know, I hope you implement it. Before you actually study for NBME and actually take the NBME, you should study and try to do practice questions. Because if you don't work on NBME questions and you go take the school's comp, which is an NBME, you might realize you won't do well. So that's why overall NBMEs, no more than 2. If you score above average, you're good to go. Schedule your stupid test. I call it stupid because I hate the USMLE exam, just because I like the reason why we have it. I don't like how it's structured, because students are failing and then their futures are set up or actually scheduled and structured and say, well, if you don't pass a step, you can't go forward. That's why I don't like the USMLE, because it really destroys a lot of people's dreams. And because people follow poor advice and then they go in, fail once, twice, thrice, and wonder what to do. That's why I don't like the test in that aspect, but it is the most difficult exam in the world. So let me navigate you to pass the thing and move on, right? So NBMEs, no more than 2. Which ones to take, don't care. Pick one and take them. They're all the same, right? Good. Next question. And please ask questions. Boom, boom. Ask questions. You can ask questions. Taking too, it's more of a statement and a question. A student asks, I take too much time reviewing my questions. Usually, and this person says, 4 to 5 hours I take for a set of 40. That's a lot. So if it happens to you, listen up. I'll tell you what to do. You can't be spending 4, 5, 6, 7 hours on a block of 40, guys. It's too much. That just tells me, and again, I hope you realize what I give you advice is because I've worked with thousands of medical students, right? And med physicians to pass step 1, step 2, step 3. So when I give you advice and I provide advice, I don't just like to hear my voice, my own voice, even though I do. I tell you because I know it works, because I see it working all the time. If you come to me and tell me this, I guarantee it's because your content isn't strong enough, or you haven't really done questions and you're trying to skip a few steps. Because if you're spending all this time on 40 questions, either A, maybe you're doing them mixed, you're not doing them focused. B, you don't have a certain structure in order. So to this student who might not be here, I'm not sure, because this was sent last night. Maybe they followed, maybe not. You shouldn't be spending 5, 6, 7 hours on a block of 40. None of my students do that. We have set focus sets when we have our online community and we have our sessions twice a week. The questions that I hand select through Amboss, I provide access to them to all my students who have an active Amboss account. So my students don't spend that much time, because they realize if you spend that much time, you can't ever succeed and progress forward in a short time frame. Okay. So ask yourself, to whoever asked this question, why am I taking this long? If you realize you're lost with every scenario, just like if you're in the hospital seeing patients and you're like, man, I'm kind of lost. Well, you got to go back and study. So quick advice, break it down. Maybe 40 questions are too much. Break it down to 15 or 20 questions each. Go into focus mode. Don't do mixed. Build your stamina, build your expertise, build your content, build your knowledge, and build your test-taking skills and strategies. So to recap, more than 4 hours is too much. I'll give you a little quick tip. If you're doing 40 questions, preferably focused, 2-3 hours. Now, again, that's 40, right? So the next day when you review your answers again, if it's a 40 block question, you should take 20 minutes. That's my rule of thumb, meaning after you've done them today, when you want to review tomorrow, reviewing is scanning the content, right? So if you have 40 questions, 20 minutes. That's what my students do. Plus, there's a couple other things you have to do. But again, it's individualized to the person studying. I always ask, why are you taking that long of time? It shouldn't take that long, right? So hope that worked. I hope that helped with that student. Guys, ask questions if you have any. Because, taking too much time, what happens is content is one thing. Reading and answering questions is another. If you're spending too much time doing that, you're not really working on content. So it's a little challenging, right? That's all. So hope that helped to whoever asked that. Another question that I love, because I get these questions all the time. How do I know? Well, no, I've asked that before. How should I balance content review and question-based learning? Let's see. How do I balance content review and question-based learning. Okay, so that's a really chunky question. Not easy. You have to have a study plan. And my other rule is basically, it's called the 1, 2, 3. Every single day, you got to do 3 things. Every single day. The first thing in the morning, review. Second thing, focus. Third thing, mixed. If you're not reviewing every morning, working on focus sets, and also doing mixed in the afternoon, then what's going to happen is you're doing too much of one thing. You're doing too much content, not enough questions. Or you're doing too much of biochem, not enough immuno. And that's the whole point. So content review, I would say for the majority of doctors here who are just starting, if you are not strong in your basic sciences, perhaps you should take 3 to 5 days per system or per topic, like biochem versus cardio, 3 to 5 days. Question-based learning, like I do with my students, I hope you all know, whether you buy my QBank video library or you jump onto my live sessions, which you get the QBank library, everything now is everything, all access monthly. You get monthly access to everything. Some people work better with question-based learning. It's like, well, I do a question on cardiogenic shock. I can learn cardiogenic shock, hypovolemic shock, neurogenic, obstructive, and septic. The problem is, if you don't know PCWP, if you don't know cardiac output, if you don't know what these are, how can you learn from the question? You're going to feel lost. So some people need to realize they have to dedicate more time to content, like watching videos, online med ed, boards and beyond, you name it, and then do questions. Majority of you have that knowledge. You're like, I know about the shock. I know about pulmonary capillary wedge pressure. I know about left atrial pressure. I know that. It's just when I get the questions, I get them wrong. Well, then you got to move to question-based learning, which is what we do in USMLE trainings each and every day. Because, guys, you're in medical school or a physician practicing who went to medical school. You're not going to come to me. I'm not going to review all of medicine for you. That's not my job. You need that. You go to Kaplan, you go to online med ed, you go to my boy, Dr. Francis Pass program. You go there, you learn all that. And then if you need more help, then you come to me after to really drill you hard in answering questions. Because the whole point is it's a 50-50 relationship. You need to know your content, and you also got to be a good test taker. And you got to know how to put them all together. That's what I do, right? So I'm going to jump and ask a couple questions here. All right, hi, everybody. Hello, hello. Hi, what's your passing ratio? 98%, never 100%. But I can guarantee everybody who I give the green light passes the exam. So clearly some people take 3 months to pass. Some people, I've had people pass in a month. I've had people pass in 6 months. You know, you come to me, I'm always honest. Sometimes I tell students, I'm sorry, but I can't help you. You really need more content buildup. Versus some students have failed multiple times. I'm like, listen, I can figure out why you didn't pass. I can help you pass. So for me, I use the very similar sequence that has helped me help students pass, thousands of students pass. It's just sometimes it takes months, sometimes it takes weeks. I had one student recently, he took 3.5 weeks, but he knew his content. He just wasn't really he had to strengthen his test taking skills. If it's content buildup, you can't pass in short time frame. You gotta review everything, immunology, microbiology. But what I do in my videos, whether you watch my QBank video or you watch my video social media, you see that I give you points, right? Points equals passing. You need to get the points. So you can't learn everything. I show you the points to get the points to pass the test. So passing ratio, listen, those who know me know that I work very hard to make sure that you pass the exam, because this is your future, not mine. It's your future, right? I do step 1, step 2. I've done this already. Ideally, this is your future in residency. So I take it personal, and all my teammates and my team knows, every one of my doctors, whether they're on the live sessions, whether they're one-on-one consultation, whether they're watching the QBank videos, whether I've just helped you online, just watching my YouTube videos, there's certain investment in all of you that I need you to do well, because you came to me for a reason. And this is what I do, right? So hope that helps. How to start preparation with step 1, from which subject? Well, like I've told you before, immunology. I would start off with immunology first. then micro, then biochem, then the organ systems. So my students, when they work with me, they follow a specific sequence because I navigate you through the waters of USMLE. It's not easy, but if you start with cardio, best of luck. If you start with biochem, you'll stop after hit genetics. There's certain reasons why you do certain things. So you want to get into the system, immuno, microbiochem, and go from there. Study schedule and syllabus coverage. Yeah, well, it's on the website. And then for the students that work with us are the ones that get access to everything as far as a study schedule and a syllabus coverage. You can visit usmletrainings.com and it tells you specifically what we cover. Immunomicrobiochem, we cover all the organ systems. We use AMBOSS primarily to answer all questions. You can do whatever your heart desires. The techniques that I show you, the tips and strategies you can use in UWorld, AMBOSS, Kaplan, Bootcamp. Again, I'm not teaching you medical school. Medical school, that's their job. You paid lots of money for tuition for them to teach you everything. I'm here to merge your content with questions. Now, at the same time, many of you can't jump on these live sessions that I have every Tuesday, Thursday. So what they do is they watch the recordings that we have with our live sessions. They're recorded. And realistically, they're archived for your access. Many students watch my QBank videos. There's samples, guys, online. There's samples in YouTube. There's samples on my website. At the end of the day, you need a QBank, Kaplan, UWorld, AMBOSS. You need first aid. And you need my QBank videos. And that's all you really much need. If your content is poor, like I've said before, you need to step it back a little bit and watch online med ed, Boards and Beyond, or read the textbooks to build your basic science foundation. If you do not, it won't work. It won't work. Yeah. Are you the one that tutors or is it your staff? Well, it's me. I do, my staff, my team, they work on the admin and the infrastructure and the social media and the marketing, advertising. I get on the live sessions every Tuesday, Thursday. I'm the one that works with the one-on-one students, and I'm the one that I have the coaching, private coaching for step 1, step 2, step 3. In the future, we're hiring more physicians, and they're going to be trained by myself. In the previous companies that I've had quite a few, I was a primary physician. And anyone who ends up doing the tutoring or teaching for us follows my strict instructions. But currently now, if you work with me, like all these students work with me in our live sessions, in our one-on-ones, you all work directly with me. And those who register have access to me via text message as well. It's not AI generated. It's not a computer responding to you. It's me and or my staff responding to you. We have extensive technology that we are all aware of every one of our students' progress. So whether it's myself texting you back at 6 a.m. or my colleagues, my team at 7 p.m. Friday evening, they're all well aware of your status and where you are in your current prep. And also, just to mention, when you do register, you get a half-hour session with me right away, onboarding to figure out where you are at, where you need to be. And also, you have access to me via text 24/7. Because a quick text goes a long way. Yeah. Well, DD, you jump on when you feel like it. We're always going to be here. As soon as you're ready, you jump on and you'll be able to get access to everything we provide our students and get more clarity. See, if you have more time to spare, please. Many students don't have a lot of time. They got to get on board sooner than later, right? So that's why we're always here helping you guys out. Everyone is on a different timeline, time frame, time schedule. Yes, yes, as I am too. So if you need anything, if you need access to me, to my team, starting next week is week 3. We're covering pulmonology on Tuesday. We have renal on Thursday. We literally hit all the organ systems week after week. At the end of, close to the end of our 9 weeks, we go over NBME training, pharmacology. And the wonderful thing is when we work with students, any questions they have, whether they're using UWorld, AMBOSS, they send it to my team. And then I attack them live. Because, guys, when it comes down to is you need certain resources that work for you. You need a study plan. You need time to study. Don't try to study in a month or less. It's not going to work unless you've taken the test before, which reach out to me and I'll help you figure out why you didn't do well. Or you have a strong foundation, but you have to work on questions, right? Just remember what I said. Watch these recordings. They literally have these are all recorded for you guys. There's the link. You could access that. You could just type in QBank. I mean, if you follow my stories and follow my social media, you have direct access to my sites. And if you are serious about joining, you can easily join. So whether you want to visit the website and see more of what we do, whether you want to type in QBank and get a response, whether you want to just take some time to think about it, it doesn't bother me. I got things to do. I'm working with students that are pushing forward. And we have students that are taking step 1 next week. We have students that just take step 2, recently scored. It's 252, 263, a couple of 248s. So, I mean, I'm happy because I know this works. And then these are all stepping stones to get into residency. If you come to me and tell me you want to become a surgeon, this is awesome. Congratulations. First thing is step 1, step 2. You want to be a dermatologist? That's amazing. Step 1, step 2. You got to pass step 1. It's getting more difficult. And you got to score high step 2. Then you have to have everything else in your resume. All right. So guys, type in QBank, QBanks. Either one works. You'll get direct access. Check out my website, DD. Wonderful seeing you. Everybody else here, thank you for jumping on. I got to go because I have a couple sessions lined up in a few moments. So again, this is recorded. It's going to be reposted on all my social media, Facebook, Instagram, LinkedIn, YouTube, TikTok, I think. And I'll be on next week randomly throughout the week, maybe in the morning, maybe in the afternoon, just because my busy schedule really is priority. My students that I work with for step 1, 2, and 3 do come first. These live streams are for me to reach out to those who have questions, those who are on the fence, those who have some doubts, because I can understand that there's a lot of resources. And now with AI, technology, so many things are going on. Everyone is a coach. Everyone is a mentor, which is perfectly fine. You go with whoever you want. But there's a difference between experience and just advice. And this is where I come in with advice and experience. And you just watch my videos, guys. Watch everything that I provide. You make your own decision because I know it works. All right. So all the best, guys. Have a wonderful weekend. Be safe. Stay safe. Next week for my students watching, Tuesday, Thursday, pulmonary renal. For those of you who are just watching, trying to figure it out, I'm always here for you. I'll work hard side by side to make sure you pass the test. All right. So have a good weekend. Jump on board. Type in QBank, QBanks, and or USMLEtrainings.com. You get everything my students get. You'll see me next week on my live sessions, Tuesday and Thursday morning. All right, guys. Thank you for your time. It means a lot to me. And anything you need, I'm here for you and my team. Ciao.